Bismillahirrahmanirrahim. Assalamu alaikum. Dear colleagues, couple of weeks ago, I had a lecture in a symposium on resmetirom in patients with type 2 diabetes and MASH. In today's vlog, I would like to share with you the overview of that lecture and the summary of the faculty discussion after the lecture. And I hope that these points will help you out in better clinical decision making in treating patients with fatal liver disease in your everyday clinical practice. Bismillahirrahmanirrahim. Title of the lecture was Resmetirom and Cardiometabolic Health, Bridging MASH and Type 2 Diabetes. The learning objective of this lecture was to highlight resmetirom's potential in improving metabolic outcomes in patients with diabetes and its evolving role in cardiometabolic risk management. The key themes and talking points of this lecture were interlink between MASLD, MASH, and type 2 diabetes, a bidirectional relationship, impact of hepatic steatosis on insulin resistance and glycemic control, the resmetirom's effect on metabolic parameters, LDL-C, triglycerides, and insulin sensitivity, and secondary benefits in dyslipidemia and weight modulation, and the data from subgroup analysis in patients with diabetes and pre-diabetes, and implications for comprehensive management of diabetic patients with fatty liver disease, and the future potential in multi-morbidity treatment, that is diabetes and MASLD and obesity. So these were the key themes and talking points in this lecture. The main points of the faculty discussion, question and answers after the lecture. Question number 1, how does the bidirectional relationship between MASH and type 2 diabetes influence therapeutic strategies, and where does resmetirom fit in? And the answer to this question was, MASH and type 2 diabetes have a shared pathophysiological foundation: insulin resistance, chronic inflammation, and ectopic fat deposition. Type 2 diabetes accelerates fibrosis progression in MASH, while hepatic steatosis worsens glycemic control. Resmetirom, by improving liver fat content and metabolic parameters, that is LDL-C, insulin sensitivity, may break this vicious cycle. It offers a dual benefit, hepatic and metabolic, making it a promising tool in integrated diabetes liver care, especially for high-risk multimorbid patients. The second question was, what cardiometabolic benefits of resmetirom have been observed in clinical trials, especially in diabetic or pre-diabetic subgroups? And the answer to this question was, subgroup analysis from the C2 trials revealed that resmetirom significantly reduced LDL-C, triglycerides, and liver enzymes in patients with diabetes or pre-diabetes. Modest weight loss and improvements in insulin sensitivity, that is the HOMA-IR, were also noted. These findings suggest resmetirom may offer beyond liver benefits, potentially improving cardiometabolic risk profiles, a critical advantage for diabetic populations prone to cardiovascular events. The third question asked was, In comparison with other metabolic agents, that is the GLP-1 receptor agonist, SGLT2 inhibitors, where does resmetirom stand in terms of glycemic impact and cardiometabolic synergy? And the answer to this question, resmetirom has modest glycemic effects, but strong lipid lowering and hepatic targeted benefits. The GLP-1 receptor agonists and SGLT2 inhibitors are more potent in glucose lowering and weight reduction, but less direct effect on liver histology. Resmetirom may complement these agents, especially in patients with persistently elevated liver enzymes or fatty liver on imaging. A future combination approach may offer synergistic benefits across the diabetes MASH spectrum. The fourth question was, could resmetirom become a cornerstone therapy in managing metabolic syndrome with fatty liver, and what gaps remain in the evidence base for diabetologists? And the answer to this question, resmetirom's profile aligns well with the emerging paradigm of cardiometabolic disease convergence. It could evolve into a cornerstone agent for patients with overlapping MASLD, type 2 diabetes, and dyslipidemia. However, long-term glycemic outcome data, cardiovascular event reduction trials, and comparative effectiveness studies with other metabolic drugs are still needed. Until then, its use in diabetes care will be selective, ideally as a part of a multidisciplinary regime for complex metabolic patients. So, dear colleagues, I hope the highlights from the lecture and the faculty discussion, the question and answers, will help you out in better understanding the role of resmetirom in patients with type 2 diabetes and MASH and obese patients. And I hope that the discussion points will help you out in better clinical decision making and treating your patients with fatty liver disease in your clinical practice. I end here, inshallah, to see you soon in another vlog on the same style and the same passion. Till then, take care. Khuda Hafiz.